Pathology of Qi mechanism. Ascending, descending of Qi in the channels. The proper ascending, descending of Qi in the channels is extremely important to regulate the movement of Qi in the whole body outside the internal organs. The ascending, descending of Qi in the internal organs is disrupted primarily from emotional stress and irregular eating. How is the ascending, descending of Qi in the channels disrupted? This occurs mostly as a result either of invasion of external pathogenic factors in the channels or of local stagnation in the channels from a trauma or repetitive strain. For example, if a channel is invaded by external cold or dampness, this will create a local stagnation in the joint and it will prevent the normal ascending descending of qi in the channel. When the normal upwards and downward circulation of qi in a channel is obstructed, pain results. Thus, the pain is due to the disruption of the ascending descending of qi in the channel. Generally speaking, if qi fails to ascend in a channel from a particular area that has been subjected to trauma or repetitive strain, the muscles below that area will feel stiff, while those above the area will feel flabby. Similarly, if qi fails to descend in a channel from a particular area that has been subjected to trauma or repetitive strain, the muscles above that area will feel stiff, while those below the area will feel flabby. Every channel has a proper ascending or descending movement of qi. For example, in the arm, the qi of the yang channels ascends towards the head, while that of the yin channels descends from the chest towards the hands in the following scheme. Arm yang channels ascend from the fingertips to the head. Arm yin channels descend from the chest to the fingertips. Leg yang channels descend from the head to the toes. Leg yin channels ascend from the toes to the chest. Therefore, it follows that the ascending descending of qi in the channels can be disrupted in the following ways. Yang channels of the arm failing to ascend properly. Yin channels of the arm failing to descend properly. For yang channels of the leg failing to descend properly, yin channels of the leg failing to ascend properly. If a person suffers a repetitive strain of the elbow, perhaps from playing tennis in the large intestine channel, this will prevent the qi of the large intestine from ascending properly and pain in the elbow will result. On careful palpation, and if the condition is long-lasting, one will probably find that the muscles below the elbow will feel stiff, while those above will feel flabby. If a person suffers from a repetitive strain or trauma in the pectoral muscle on the lung channel, this will prevent the qi of the lung channel from descending towards the head. This will create a local stagnation in the pectoral muscle and therefore pain. If a person suffers from a trauma or repetitive strain in the thigh muscle along the stomach channel, the qi of the stomach channel will fail to descend properly. This will create a local stagnation and therefore pain. On careful palpation, and if the condition is long-lasting, one will probably find that the muscles above the stagnation area on the thigh will feel stiff, while those below will feel flabby. If a person suffers from a trauma or repetitive strain in the calf muscle along the spleen channel, the qi of the spleen channel will fail to ascend properly. This will create a local stagnation and therefore pain. On careful palpation, and if the condition is long-lasting, one will probably find that the muscles below the stagnation area on the calf will feel stiff, while those above will feel flabby. Therefore, we can say that in every channel problem, that is a local problem not involving the internal organs, caused by trauma or invasion of external pathogenic factors, there is a disruption of the ascending descending of qi, which causes local stagnation and therefore pain. Thank you for your attention.